Hey everyone, Nurse Allie. Welcome back to my channel. So I wanted to do a really quick video talking about what I did to pass my NCLEX on my first try, and it did shut off after 85 questions. And I had a few people comment on my NCLEX video asking what programs I used to pass, so let's talk about it. So the first thing that I did was I really took a step back and I had to humble myself, honestly, and just realize that no amount of studying is going to make you feel 100% ready to take the NCLEX. What I did was, as soon as I got my ATT, I signed up for my exam and booked it for at least 2 weeks in advance. So that way I gave myself a timeline so that I would force myself to study and review. So the first thing that I used to study was the ATI NCLEX-PN review book. I felt like this book was so valuable to me getting like a good refresher on all subjects. My school did give it to me for free, like the last week of school, but I'm pretty sure you can buy it online for like $40 to $50. I highly recommend this, whether you're in an LPN program or an RN program. I know that they sell both versions. This helped me so much because it goes over every single subject and it really breaks it down about what's the most important thing to know, whether it's a certain type of disease, whether it's an EKG. It has everything you truly need to know for the NCLEX, and it doesn't over-clutter it with extra information. And to be quite frank with you guys, I did not have time to review the entire book. I personally went over areas that I did not feel super strong in, so EKGs, electrolyte imbalances, and then I also reviewed some adult med surg, specific body systems, so like respiratory, GI, just things that I kind of needed a refresher on, and then peds and OB because those are not my strong subjects at all. So that's what I did, and I would just take little notes. I would write in the book and then like on a piece of paper just so I could try to remember some things. And the last thing that I did to study is I decided to stick with ATI for practice questions instead of buying UWorld or Archer. Personally, I don't really think it's necessary to buy those, and I was so set when I was in nursing school that I was going to use those programs. But once I got out, I was just like, you know what? I'm just going to use what I have. ATI is challenging enough. They have a whole section that mimics the NCLEX exam. They have, thousands of practice questions. Why would I pay just to have more practice questions? And it's like the same thing. So I used ATI and I did the NCLEX board exams, and then I also did the dynamic quizzing section, and they're like the same thing. I did also have Mark Klimek notes for NCLEX prep that a nursing friend had sent me. And I did also watch a series on Mark Klimek lectures on YouTube for pharmacology review. And I felt like they were good, don't get me wrong, but personally, I need to write stuff down to really remember and understand it. So I felt like it was good, but at the end of the day, I think it's best to stick to just a few different types of studying, because when you're doing way too much and using all these different programs, books, videos, whatever, you're seriously gonna burn yourself out, you guys. And you have to remember, you need to have a refreshed mind to take this exam and be successful. And that's everything that I did to study for the NCLEX. At the end of the day, you guys, just remember, you're not gonna remember everything. You're not gonna know everything no matter how much studying you do. There are going to be questions on NCLEX of things that you've never heard of or seen before, and that is okay. That is 100% normal. You don't want to feel overly confident going into the exam because then you don't care enough. but also do not kill yourself with anxiety, because all you can do is try your best, slow down, take a deep breath, pray. And if your testing site gives you silencing headphones, I highly recommend them, because I use them during my exam and it helped me so much, because I have ADHD, and if I can even hear someone like adjusting themselves in their chair, it's distracting. So good luck.